and family acceptance, again, is one of the factors that is really strongly linked to youth positive health outcomes that is modifiable. And that's why it's so important to think about is kids that have either less rejecting parents in the gender and sexual minoritized kids world. That's the Ryan 2000 studies. And then the Olson trans youth studies talk about, again, early affirmation, early acceptance and support. These kids have anxiety and depression rates that look like their siblings and their peers. That's unheard of in the transgender world. And that's unheard of in the transgender world that's been living with minority stress impacts for years and years and years. And again, that role of professionals, how we can implement these screenings, this identification, these supports, this education for families, again, to help homes and schools be healthy, safe places for kids. So thinking about sort of who and when to screen, well, all children. Again, everybody's going to go through, gender development. Talking about it with cis kids is great because then it models, again, language to use with their trans peers. It models acceptance. It models that you as a provider don't take anything for granted and you're not making any assumptions about their identities and their needs and their viewpoint. It also is really important with diverse or non-conforming expression. We'd get referrals in the clinic that I used to work in, which would say, a pediatric note that'd say depressed, tomboy, Prozac. And that was it. So if kids are giving you clues, to ask them more questions, to be curious, what does that mean? What does dressing goth mean to you? What does that look like? Kids are, coming from a place of honest curiosity that's about learning about them. Kids are very happy to talk about themselves in so many different ways. And then, of course, when we're talking about concerns with mood and behavior and social problems, that ends up being really, really important, again, in terms of maybe a little bit more aggressive time and screening. That might be having a conversation, again, with parent or caregiver outside of the room, and including in that psychiatric, mental health, behavioral health discussion, again, questions about gender and sexual identification and orientation. So